What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, September 13th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there. You need to know what's going on with each and every one of these viruses. That's what I do each and every day here on my channel. I give you the latest news from the CDC, data, news stories, and our big focus here is COVID. Today we're going to talk about COVID. We'll talk about Mpox, maybe some other viruses as well, depending on whether or not we get to wastewater today. But the main goal of this channel is to keep you informed and safe with what's going on in your community. Mostly it is the United States. Sometimes we add Canada. Sometimes, if I do find things from other parts of the world, I talk about that as well. Want to stay informed each and every day? Subscribe down below. Give this a thumbs up. Hit that notification bell. And of course, share this video with anyone you know. Alrighty, today's a Friday, and today's not just any Friday, it is Variant Update Day. Yes, we do have new variant data from the CDC, and something's happening. I'm going to say this. Something is happening that has not happened since last winter. See if you can figure out what that is. I don't think it's a terrible thing. I mean, it's not a good thing, but I also don't think it's a terrible thing, and it may finally end our trend of variant after variant this summer. I'll leave you thinking about that for a moment. We'll get to that in a little bit. Of course, we have some other CDC data. We do have new data from California. We have some new numbers from some states, and we're starting off today with a COVID study. Study reveals how COVID-19 infection can cause or worsen diabetes. If you want to read the full study, you can go ahead and do so. We have seen many studies before. I have an archive on my website, datareport.info, and one of the sections in the studies archive does include diabetes. This one will make it as well. I mean, it's just on and on we go. With this, it's round and round we go. Every day we find out something new this virus can do, or we find out something that confirms something that we previously thought we knew about the virus, and in this case, it's diabetes. I think my section for diabetes, I think it's over 10 different studies now. It's really starting to grow, and yeah, yet again, another study here that talks about how diabetes can get worse, or even if you didn't have diabetes, you can get it because of a COVID infection. COVID can impact your kidneys. So that full study will be not only on the site once in the archive, but it'll make today's thread of news stories used in the pandemic update. All right. Everybody knows who Julie Chen is. Well, maybe not. I should be fair. Julie Chen, host of Big Brother. Also, is she still on the TV show The Talk? She used to be last time I watched it, and that was long before COVID, I'll be honest with you. Anywho, she has tested positive for COVID. So, yeah, even though we are on the backside of this summer wave, there are still people testing positive. I also saw the new president of Notre Dame University also tested positive for COVID. Janet Yellen this week tested positive for COVID. Eric Adams this week tested positive for COVID. So it seems to me we're seeing equally as many famous positives on the backside of this wave as we did on the front side of the wave, indicating that right now you do not want to let your guard down. It is equally as risky out there at the moment. All right, remember, I think it was last week or early this week, I don't recall, there was the report that there was a human case of H5 bird flu in Missouri. Well, there's a little bit more information out coming from BNO News. Let's read what they put, and there is a whole bunch more. They posted a screenshot from the CDC, and it says no contact with wild birds, domestic poultry, cattle, or other wildlife, no consumption of any raw dairy products. Yikes, two things not good. Here's the biggest red flag. A close contact was sick at the same time, but was not tested for bird flu. Now, I'm not going to say it was human transmission, but this is about the closest we have seen anything towards H5N1 human transmission yet. I mean, we're starting to eliminate a lot of possible ways of being infected, and a close contact with someone being sick still exists. So, don't know. It would be nice to know if they could maybe test that person for antibodies. Then maybe we could get some clues, but eliminating not being around farms, not consuming raw dairy products, that's an alarming red flag. Of course, it's something we're just going to have to continue to monitor. All right, Mpox, real quickly. New York City did release an update on Mpox, and it says since January 1st, 2024, 352 people in New York City have tested positive for Mpox. There have been 38 cases in the last month from August 11th of 2024 to September 7th of 2024. This data is as of September 12th at 1 p.m. and all this is the clade 2 strain. In other words, the older strain, not that 1B clade. All right. In case you did not see yesterday's video, here's what the UK posted this week. Weekly cases, 1,587. That is up by 65. Weekly deaths, 102. That was down by 27. That's why it's in the green. Green is good. And healthcare patients admitted to the hospital for COVID, 1,465. That's down by 104, or 6.6%. So that's down by 6.6%. Deaths are down by 20.9%. That's not a bad thing at this time. All right, taking a look at what is going on with heat-related illnesses, and there are still some out there, especially in the Great Lakes at this time. Southeast has some, Southwest, still some in the Northeast as well. The Northern Plains is one place where we're starting to see them come down. You don't see many counties there at all with heat-related illnesses. That is a good thing. Pollen levels for today. Let's refresh this. And I got a feeling it's pretty bad. Yeah, 42% of the country is in medium status. It's coming up yellow to green here. And allergies, it's been the thing here today. I've seen people hurt. Well, I shouldn't say seen. I've heard people sneezing today. So, yep, allergies are out there. Take a look at this. Texas, Oklahoma, Arkansas, Louisiana, Kansas, and portions of New Mexico, even looks like a county in Colorado today, is in the red for pollen levels. That's never a good thing. Take your allergy medicine if you live in those areas. Air qualities across the United States are absolutely horrible today. And I don't mean horrible in the sense that there's a lot of purple and red, but horrible in the sense there's just a lot of yellow everywhere. And actually, I guess I should correct myself. A couple hours ago, this looked a lot worse, but it's still not perfect, and there's still a lot of yellow around and even oranges in the plains. And then you come up here to southern Canada, and there's some problems there as well. So that's something that we should be concerned about. Wildfire smoke has shifted up there. Hopefully it does not come southeast into the U.S. Wow, take a look what's going on in Alberta, Canada. Those are some really bad air qualities, and we should be concerned about that. Want to learn more about the climate and the weather? You can do that over on my other X account on Twitter, formerly known as Twitter, which is Climate Data Report. I'll be doing some tweeting there this evening. I'm sure I will have some news stories to tweet there. All right, this is not good. Philadelphia yesterday, 888 EMS calls. Not happy about that. That's darn well near 900 calls yesterday, and as we know, I talked about it yesterday. The suburbs were just non-stop for ambulances yesterday, and apparently Philadelphia was as well. So that is not a good thing. Take a look right now, live looking at Montgomery County, Pennsylvania, and we see there are a few calls. Respiratory emergency a couple times, medical alert, seizures, lacerations, maternity. Hey, congratulations to the person who's having a newborn baby. Take a look at this, nauseous and vomiting, 12 calls total. Chester County, Pennsylvania. You do see there are quite a few calls, but look what we do not see. Sick person. Hey, that's a good thing. Most of our pandemic updates have been showing sick person the past several days. Respiratory emergency does show up at this time. Taking a look at the viral levels for viruses in Canada at this time, and I did need to refresh this to make sure it is up to date. Moderate level for COVID-19. Flu A is low. Flu B is now being detected, but at low levels, and RSV is low at this time. Taking a look at Walgreens for this week. The positivity rate is 29.9%. That's a difference of down 3% from 32.9%. Last week had 10,030 tests. The prior week had 13,537. So the number of testing is going down, but hey, the positivity rate still dropped. What does that mean? It means we have likely peaked here in the United States. Something else that has peaked. Take a look at this. This is the viral activity level in wastewater for COVID, and it's now just listed as high. Before it was listed as very high. You can see here it is starting to drop, which is some good news after the long rotation summer rise that we saw. I mean, it started rising back in May, and we are now finally seeing it drop. We will do our regular wastewater update Sunday. Well, I don't know about that. It may be shortened in terms of wastewater Sunday. I'll explain about that in a few moments. Taking a look here at the virus levels or the COVID levels, on this map that we look at, the various different colors, and I can finally say the number of dark blue sites, that's really low levels of COVID, is finally slowly starting to increase. But hey, it's only 30 sites, so I mean we have a long ways to go. We need to get that back into the hundreds and get these down into the double and single digits, because the number of orange and red sites is still very high, and believe it or not, number of red sites, it's saying here, went up by 4%. That's sites, wastewater sites, with 80 to 100% COVID detected, and that's still at 291. 60 to 79% COVID detected is at 522. And we don't need to look at this map. No, we'll skip this map for now. Let's take a look at some new COVID variant data that just came in. And as I said earlier, I said something is happening that has not happened since last winter. You know how all summer we've had variant after variant, KP.3.1.1, KP.2, KP.3. LB.1 at one time was a candidate to potentially go up. On and on it goes. Well, guess what? KP.3.1.1 is trying to clear the board. Let's scroll down a little bit. It's now at 52.7%. All the other variants are starting to drop, and there's not many now that are over 1%. Let's see, KP.2.3 is at 12.2%, LB.1 is at 10.9%, KP.3 is at 10.6%, KP.2, 3.1%, LP.1 at 2.1%, KP.1.1.3, 1.9%, JN 1.18, remember that variant, 1.7%, and KP.1.1, 1.5%. And then there's a whole bunch that are under 1%, but again, it is starting to take us out of variant soup, which is some good news. And you can see here on the chart, there has been a big increase just within the past week for that KP.1.1 variant, or the last 2 weeks, I should say. Alrighty, moving on. This is something else that's good. I know, I'm full of good news today. Take a look at this. A lot of states now that are likely declining or declining, but there are still a few places that are likely growing. South Dakota, Montana, and Idaho at this time are likely growing, and stable or uncertain is quite a few states as well. Likely declining would be Vermont, New York, which includes Long Island, Delaware, and if you look really closely, District of Columbia is now listed as likely declining, West Virginia, Alabama, Mississippi, Arkansas, Kansas, Oklahoma, Nebraska, Colorado, Utah, and Arizona are all now likely declining. States that are declining would be Maine. Hey, that's some good news to see Maine. I mean, their cases are still very high, but if they're saying that it's declining now, that's indicating there could be a peak and it's going to finally drop soon. So Maine, New Jersey, Maryland, Virginia, North Carolina, South Carolina, Tennessee, Kansas, Indiana, Ohio, Florida, Louisiana, Texas, New Mexico, Nevada, and the state of California are all declining, and I missed one before. Likely declining. Also Hawaii, Alaska, which is not one of the 48 states, it's one of the 50 states, but it's not the lower 48, is stable or uncertain at this time, and there's quite a few stable or uncertain states at this time. Alrighty, moving on. ER visits. Take a look at this. ER visits for people diagnosed with COVID nationally. They're starting to rapidly drop. Look at that. It's almost going straight down. That is some really good trends to see that happening. Alright, moving on now to flu, and just one place that is concerning. That is Washington, D.C. Flu levels are now moderate, and they were last week as well. If you're in D.C., the time has come. You got to go roll up your sleeves and get that flu shot. It's time, because, hey, flu, it's prevalent by a moderate amount in your city at this time. Alright, I think we're going to skip over wastewater for today because we do have some data and notes to take a look at now with more states. And first off, in my notes, I do have Saturday. It may be one of those out in the wild updates. I haven't fully decided yet. I may have some notes printed up for tomorrow, and that's how we go. And there's always something fresh on my mind that I want to talk about anyhow, so maybe we'll talk about that tomorrow as well. So I think it's going to be an out in the wild update, and Sunday's update will feature the wastewater. But if I do an out in the wild update tomorrow, there may be a few news stories that come along that we have to report for tomorrow and Sunday. Who knows? We'll see how the news goes. Sometimes it's slow on the weekends, and then a couple weekends ago, what do we have? Close to 10 different news stories on a Saturday. It can happen. All right, some data from CJS 83172. Florida yesterday had, not good, 2,270 new cases. That's fair, but here's what's not good. Another 56 deaths in their daily update. New Jersey had 1,190 new cases, as they likely did a bit of catch-up from the day before, and 2 new deaths. And then yesterday, New York, as we know, had 2,215 new cases. Virginia had 1,034 new cases and 3 new deaths added to their open data page. Washington, D.C., 122 new cases, not seeing anything about deaths. Delaware, 482 new cases and 3 new deaths. Georgia, 4,638 new cases and 24 new deaths. Kentucky, 3,113 new cases and 24 new CDC reported deaths. Massachusetts, 2,383 new cases and 17 new deaths. Minnesota, 3,370 new cases, as they likely got hit by a case data dump. Yeah, there's got to be some backlog in there, but take a look at this. Another 22 deaths. I'm feeling it. I think we're easily having another week over 1,000 new deaths, and I feel it could be over 1,200 again this week nationally. I mean, look at this. North Carolina added another 44 new deaths. Nebraska added another 697 new positive tests and 6 new CDC reported deaths. Ohio, which I covered yesterday, had 10,315 new cases and 26 new deaths. Utah, 1,169 people added to their living with COVID. In other words, they tested positive, and they also added 4 new deaths. Vermont added 278 new cases and 4 new deaths. Vermont, your death wave this summer has been absolutely just terrible. I mean, who remembers when Vermont was one of the better states? All right, let's take a look at what's going on in New Jersey today. 474 hospitalizations reported there, with 69 out of 70 hospitals reported. I want to say this is probably an accurate number today because hospitalizations have been dropping there. One way to check that is we could zoom this in. That's time consuming. Well, it's allowing us to zoom in. Their New Jersey's website constantly freezes up on me, and we can see here, yes, this is likely an accurate number, and now we won't be able to see the other data, right? On a ventilator, 10. How about ICU? Oh, no, it's working. 58 people in the ICU, and discharges, 90 discharges at this time. All right, taking a look at New York State for today, I do have some bad news here. Not everything is good news today. New York State, 1,950 cases. And if we go back to last week at this time, of course it refreshes on me. If we go back to last week at this time, looks like today's number is slightly higher than what was reported on September 4th, when they had 1,835 new cases. And the hospitalization number, it's continuing to drop. It's just not dropping as fast today. When we take a look at today's number, 1,048 in the ICU, 109. I'm confident next week they'll drop below 1,000 for that. Quickly taking a look at what's going on in Los Angeles. Yeah, your deaths are still rising. Deaths are the last lagging indicator in a wave. Hospitalizations are dropping. That slowed a little bit. That's not good. Cases are actually dropping a little faster. And testing positivity rate, it's down to about, we'll say, just shy of 9%. California, good news here. The positivity rate is dropping. COVID deaths, it looks like they are dropping slightly. And influenza deaths is dropping. Influenza positivity rate is 1%. COVID positivity rate is 10.7%. Alrighty, folks, that does it for the Friday edition of the Pandemic Update. We'll have another update again tomorrow. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and leave your comments down below. I'll see you all again tomorrow. We'll be here. We'll be out in the wild. I don't know. Until I see you again tomorrow, Stay safe, everyone, and have a fantastic Friday evening. Thanks for watching.